Another repeat client has a GP practice down the street, actually 2 houses over essentially, connected via a alley. So he wants to pull oral surgery out of his current practice, same model essentially. He's got a house he's moving into, so some constraints.
Right, existing entry.
Existing entry. Architect is adding on this stair tower, lots of glass on this corner here, kind of rehashing the entry.
Does this exist or this not? I'm unclear
This
on
door exists, this does not exist, so he's,
that. And the bathroom exists?
it does not.
Oh,
It's already kind of pre-approved in that location, so I didn't really want
Yeah,
to mess around with that.
there's a little bit of a challenge on this one. It's one of the 17 elements to go ahead and have direct face contact as someone comes in through the vestibule. It's not a mortal wound. I mean, it's not and this is not going to have the volume of traffic where there should not be very many people in the waiting room, other than perhaps people waiting for people that are sedated here.
Correct, yes.
So, in this situation, as much as we'd love to have this entry here, but then you'd have, if you didn't change the other geometry, you'd have the bathroom here. Let me see if I can get that on screen better.
Yeah.
You'd have bathroom here, which then has the bathroom off this, which people don't want to use. Because you don't want to come back out and go, hi everybody. So
Yeah.
this is more private for that. And if you're forced to make the decision between the two, I'd compromise the entrance rather than put the bathroom right on the waiting room.
100%. I think I can catch enough visibility here that they're going to know who's coming
As
in.
soon as you come through there, this person needs to be attuned.
You can also cut back this corner on the wall.
You could-
Yeah, either cut it
I'd
back,
consider
make it
cutting
a
that corner
half-plate.
back.
Problem there is, I tried that, but this wall goes all the way up to the 2nd floor. So that's my structure.
Bubbling that desk out, this is a very rectilinear design. You can kind of see how your aesthetic, Kenzie, would be on this. And if you bubble that out, just an unnatural, a gratuitous curve.
Yeah.
It may be a functional curve that you consider. Dental offices tend to do that way too often. It's put a curve front desk in, that's for no reason at all. And this is perfect. I mean, it's beautiful as a straight desk. And this creates a constraint there, which I think is a traffic. A person can stand there if you bulge it out. So in theory, this person could see this better. I don't know if I'd change it.
Right. I could coordinate with the architect and see if maybe if we could just pull this back a little bit more, and maybe I kind of add some structure over here to make that work.
Yeah, if it's not a big deal, you just ask them.
Yeah.
Ask them, but if the answer is no, then you go straight, it's fine. In terms of surgical, I might consider that,
Okay.
to keep this
wall
to
there.
really make that attractive, which pulls away from the view there. I think I'd be inclined to do that. And then those two run the same way, at least. There's, once again, no real preference for which way these work with I'd go slim Manhattan, and because you create a great amount of space at the base. This room obviously has length that you can do whatever you want to do. Any other things? Obviously, what happens here in terms of actual, how they happen to set up a table there will probably be different. That's their
Slightly
deal.
different. That's equivalency break room.
Right.
There's a upstairs that they may keep as an apartment one half, and then the rest is going to be kind of business admin.
I
Again,
think we're gonna-
offload some of that function from the GP
For
practice.
the GP
right-
practice,
right down the
right.
street.
Yeah. And so will they be doing teaching, conferencing here, or training, or what's the anticipation?
Well, I believe they're SI, is that correct?
Yes.
Yeah, so they'll do their SI events there.
Great.
Um,
Excellent.
So their team is growing significantly.
Mhm.
Challenge with this upstairs space is headroom. It's a
Mhm.
pitched roof. You can see our dormers
Yeah, yeah.
here.
Yeah, so they're only gonna be
Here.
able to get so much space in. I'm not sure that you've got two lunch areas, both of them a little small. I try to steal some of this,
Mhm.
would be my inclination to go ahead and grow that
Okay.
one. I think you're gonna have trouble growing the other one.
Mhm.
And there'll be 8 employees somehow. They're gonna grow this thing. They're gonna wind up, it will be very successful. So I'd just be inclined. Is this the total space?
That's
If they
the total
take the whole
space.
thing, they should take the whole space.
The only thing I was seeing from a clinical aspect is gowns, special gloves, bulk storage,
Surgical kind of.
surgical appliances.
Changing room?
Like, there might be, you might limit yourself to those 4 pull downs only. You don't know if you're
Let's go
able to
back.
take off that corner
Let's go
of
back.
last and go straight
I-
down.
Are they doing is he gonna be doing all lawns? Is that what
That was
the
my other question on it.
proposal
I'd
is?
likely
3D printing
do
on
as
that?
much as possible.
Yeah.
Mhm. You've actually got a lot of storage. You know, we demarcate lab and sterilization. Most of the lab, they're not gonna have a lot of cases. So a lot of this storage, which in a GP practice would be cases in and out, Invisalign boxes, 8 million Invisalign boxes, are not gonna exist in this office. So I think they get a lot of storage back in this space that can be useful, bulk storage for what they've got. But that should be mapped out. We should get a clear discussion of what their vision is on that to
Mhm.
make sure that we've got the space for that. Good.
For inventory, because this is oral surgery only, is
Mhm.
inventory for procedural supplies much reduced, or is it?
Here's some bone. Implants are the biggest inventory
Mhm.
pain in the neck in oral surgery. Because you got 8 million little fixtures and you need to get them to the rooms. I would seriously consider a small drawer mobile for that
Kind of implant cart?
implant cart. Because if you try to go ahead and just inventory it here and then bring it to the room, somebody's running for a part and sorting through a drawer. It's their own sterile pack, so it's not a problem that way. But I would prefer that if it were me. But the question is, how many systems do they need to accommodate? So in a GP practice that does implants, I'm gonna have 2 systems. That's it. And maybe I'm gonna accommodate a third, but I'm gonna begrudge that. As an oral surgeon, if they're getting referrals from outside, they gotta deal with 30 different implant systems. It's still horrible. And so that may make it impossible to fully mobilize it. And they just have to know in advance what implant system, they're setting up for. And you could have actually a sliding kit. So you get there, here's the 3i system. Here's
Deploy to the room in a tub?
And
so to
just
speak?
deploy individual tubs out of slots. Actually using the sterilization, the resupply drawer, set up as a place to do that. So that discussion needs to happen. Does he have the oral surgeon yet?
Don't think so.
Yeah, I don't think so either.
Okay, so that's a discussion. If he wants to have that discussion with me, I'm happy to talk to him about that.
Okay.
Okay, because it will be an issue.
Mhm.
Great. Anything else on this? But I think he's gonna be, it's just a great move to go ahead. Again, another smart move.
Yeah. Yeah,
Just
Care-
saying.
Care center will be.
Just saying, care center, it's an opportunity to have like a thing. I mean, have you spent much time in the care center? I would go ahead and like, take your laptop up to the patient care center sometime and just work from that room for a few hours. It's sublime.
Yeah, we were just in there for for a while when we were.
It's sublime, right?
Yeah, we
Yeah, okay.
brought Lori to
Right.
Seacrest yesterday, and he couldn't believe how quiet it was.
It's just,
Yeah.
I mean, we designed it. I've studied acoustics for a couple of decades. I'm still astounded. I still am astounded at how, and a lot of that is caught in the ceiling. There's a fair amount of that in white noise, but those desks work. So, yeah, so that's a challenge now to take it into other realms. Now, they're not, the conversations that they're having are professional, and so they're more controlled. You're making an appointment. It's not an emotional discussion. You know, calling to remind you to, their laughter doesn't happen that often. So there's some constraints that make it easier to make that work than other places that we might try to sound attenuate. So, but it can be done.